come in.
Hi, my name is Leilani. I'm an LCC nursing student. I'm here to do your assessment.
Okay.
Okay. Can you tell me your name and date of birth?
Amanda Sowers, 07/03/1992.
Okay. So what brings you in today?
I have a sore throat. I've had it for about 2 weeks.
Okay. Do you have any? How does it? The characteristic of it?
It's sharp.
And how long has it been going on? You said 2 weeks.
2 weeks.
Do you have any? Does it radiate anywhere?
No.
What makes it better?
Cold items.
What makes it worse?
Hot items.
Do you have any associations with it, like nausea, vomiting?
I have a slight cough.
Okay. Are you producing any sputum with that cough?
No.
Okay. And do you have any other outward signs of pain?
No.
Okay, so let's go ahead and go to the examination bed and I will look you over.
Okay.
I'm going to clean my hands so that way when I'm touching you, you know that my hands are clean. Okay. And you already gave me your name and date of birth, but can I check your wristband while you say that?
Yep. Amanda Sowers, 07/03/1992.
Okay. Do you know where you're at?
A hospital.
Okay. And do you know what today is?
January 24th,
Okay.
2021.
Do you know who the President of the United States is?
Biden.
Yes. Okay. So, patient is a 28-year-old female, alert and oriented ×3. Her developmental status is within normal range. Her speech is clear and understandable. And with her gait, we've seen her walk. She was, her posture was erect, equal steps, and steady gait. Okay, so you can go ahead and relax. What I'm going to do is head to toe assessment.
Okay.
So it's exactly like it sounds. We're going to go from head down to your toes.
Okay.
And listen to everything. So I'm going to just clean my equipment. Okay. The first thing I'm going to do is put on my equipment. Clean. Yes. And clean this. Okay, so I'm going to start with your eyes. I see that you are wearing glasses, so that would be your assistive device. I'm just going to move this real quick. Okay, so can you take off your glasses for me? Look straight ahead. Okay. Nope, look straight ahead still. Okay, I'm gonna touch you, okay?
Okay.
Does this hurt?
No.
Okay, so your pupils are 4 millimeters in diameter, round, reactive to light, both indirect and direct. Your conjunctiva are clear and sclera white. Okay, so I'm just going to look at your ears now. Can you sit up just a little bit for me? I am going to touch you.
Okay.
Okay, can I see this ear? Okay, so ears are intact with no lesions or bruises. There is no visible cerumen noted. So now I'm going to look at your nose. Okay, nares are patent. Mucosa is pink and moist. I'm going to touch again, okay?
Okay.
Does that hurt?
No.
Does that hurt?
No.
Denies pain with palpation. Okay, can I look inside your mouth? Okay, can you say ah? Can you show me your gums? Okay, bottoms. Okay, so we do note some abnormal dentition. Mucosa is pink and moist. Lips are dry but intact. Sorry. So go ahead and lay down. Okay, so eyes, ears, nose. Okay. Oh, my pen light. Next, we're gonna go to respiratory. So I do need to put this on your back and on your chest. So
Okay.
maybe if you sit up, it might be a little bit easier.
All right.
Okay. Okay, take a deep breath. 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 Deep breath. Gonna go under your breast, okay? Take a deep breath. Same on this side. Take a deep breath. Take a deep breath. Take a deep breath. Okay. I'm gonna do the same on the back.
Okay.
And I would be doing this on a bare back. Take a deep breath. Take a deep breath. Again. 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 I'm going to listen in here. Go ahead and lift this arm for me a little bit. Breathe in. Again. Breathe in. Okay. Lung sounds clear to auscultation in all fields. On her shoulders and back and bony prominence, her scapula, clavicle, there are no red areas or any signs of things being broken down. Okay. I'm just going to check your pulse real quick. Okay, your respirations are 16 with even pattern, moderate depth, no use of accessory muscles. Her AP to T is 1 to 2. All right, now moving on to cardiac. So, do you have a preferred arm that you would like me to use? Your right or left arm? Okay. So what I'm going to do now is I'm going to measure to make sure I have the appropriate cuff. Okay. So it's about 80%. And that's about 40. So the cuff size that I'm using is an adult large. Okay. So I'm going to bring a pillow so that way your arms kind of relax and within heart range. And so what I'm going to do is called a 2-step method. So I can find out how high I need to pump up the blood pressure cuff, okay? So what you're going to feel me doing is I'm going to grab your radial pulse and pump this up until I don't feel it anymore. Then I'm going to release it. We're going to relax for a minute, and then I'm going to use my stethoscope, okay? Okay. So we're going to let it relax for a little bit. Sorry, I'm actually going to wait. All right. Okay, your blood pressure is 128 over 62 is within normal range. Okay. Perfect. So we can put that away. I'm gonna check your O2. Okay. O2 is at 100 on room air. Okay. Now I am going to listen to your heart. Or actually, let me check your neck first for any jugular vein distension. You have to be at a 30-degree angle. So, okay. So can you, okay, 30 or 45-degree angle. So I'm going to say you're at a 45. I'm going to have you look that way. Okay. No, JED noted. Okay. Can I touch your neck? Because I know you did say it was sore. Does that hurt?
No.
Okay. So no bulging vessels noted either. Okay, so I'm gonna check your, okay, you can sit back up. I'm gonna move the camera so you guys can see what I'm doing. So if my cameraman would politely move it so they can see what I'm doing. Okay, so I'm gonna touch your neck again because I need to find your carotid arteries. So I'm gonna go to the trachea and then go up a little bit. Okay, they're at a +2 bilaterally. Okay, so now I'm gonna listen to your heart in the APT method. Okay, so I'm gonna go to the second intercostal space, which is your aortic listening site. And it correlates with the carotid artery. Okay, so I'm just gonna listen for a minute. Okay, so her aortic pulse was 66 regular with without, or S2 was louder than S1. So now I'm gonna go to the tricuspid listening site, which is the second intercostal space, left sternum. This is the pulmonic listening site. I'm going to listen to it again, okay? Okay, it is again at 66 beats per minute. S2 is louder than S1, and I don't hear any murmurs, rubs, or splits. Okay, so now I'm going to go to the herbs listening site, which is the third intercostal space, which is just one below this, and it is in the left sternum border. Okay, at this listening site, it was 68, and S2 is still louder than S1. It's equal with no murmurs or rubs or splints. Okay, so now I'm going to go to the tricuspid listening site, which is the 5th intercostal space. 5. Okay, and listen. Okay, that one's at 68 also. Now I'm going to go to the mitral, which is the 5th midclavicular. So I'm going to go under your breast, okay?
Okay.
I'm going to just lift. Okay, and that is also at 66, regular rhythm. No murmurs noted. So I'm going to switch to my bell side now. Oh, and S1 was louder than S2 that time. And I'm just going to do the same pattern, okay? I'm going to lift again. Okay, go ahead and lay down. And cameraman, you can move back. And I did not hear any abnormal sounds with the bell side. Okay, so I am going to check for edema in your arms, so if I can see your arms. Okay, skin texture is warm, dry, warm to cool, distal to proximal. Okay, let's see, I'm gonna squeeze your finger. Your cap refill is 2 seconds and brisk. There's no clubbing of the nails, no edema noted, no breakdown on the bony prominence. Can you see this one? Okay. Also brisk, 2 seconds, no clubbing of the nails, no edema, no breakdown of the bony prominence. Okay, so now I'm going to feel your radial pulse on both sides. Okay, those are +2 bilaterally. Now I'm going to feel your ulnar pulse, which is right here. Those are +1 bilaterally. Now I'm going to do your brachial pulse on both. Those are also +1 bilaterally. Okay. So now what I'm going to do is I'm going to do what's called a grip strength. So I'm going to want you to grab my fingers and squeeze. Okay, so when I push towards you, I want you to resist, okay? Now I'm going to pull away and I want you to resist. Okay, grip strength is 5 out of 5 bilaterally. Okay, so now I'm going to do your abdomen. I am going to have to expose you, so I'm going to cover you up so you stay warm. Are you warm?
Yeah.
Okay, so I am going to expose your belly. When was the last time you had a bowel movement?
This morning after I woke up.
Okay, can you tell me the consistency?
It was brown and firm.
Okay. I'm just going to inspect your stomach. Okay. Do you have any areas on your stomach that hurt?
No.
Okay, so I'm going to listen. Oops, let me switch this back. It would probably work better. Okay, bell sounds are active in all quadrants. I see you have a scar right here. Is that from a belly button ring?
Yes.
Okay, so she does have a scar. Her abdomen is round, equal. I'm going to palpate it now, okay? Does that hurt?
No.
Soft and non-tender. Okay, so cover you back up. Now here's where I would do the femoral pulse. But for my patient's comfort level, I'm not going to do that. But I would have her bend this knee, and then frog leg out, and I would check for the pulse. Okay. I'm gonna look at your legs. So pretend that she doesn't have anything on her legs because I would have to examine this. You would have a gown on. Okay, so I'm just gonna touch you. Okay. Okay. Any tenderness?
No.
Okay. I'm gonna lift these up just a little bit.
Okay.
Just so I can see. Okay, sweep, sweep. I don't feel any edema. Okay, she does have a bruise on her left shin right here. She does not have any breakdown on her bony prominence, the ankles. I'm going to take off your socks, okay? No breakdown, no breakdown. Just going to look. Okay, so no breakdown on the bony prominence. Okay, so I'm going to pinch your toes, okay? Okay, cap refill is brisk. There are no clubbing of the nails. Okay, I'm going to feel your tibial pulse. Or post-tibial pulse, sorry. Those are +2. Okay, so now I'm going to feel your dorsalis pedis pulse. Dorsalis pedis pulse, sorry. Those are also a +2. So now what I'm going to do is I'm going to lift your legs up and I want you to pull down, okay? Okay, and then I'm going to hold your legs down. I want you to lift up, okay? So now what I'm going to do is I'm going to push your feet up and I want you to, as if you were doing gas pedals, okay? On both feet. Gas or brake, whatever you want to call it. Okay, grip or against resistance, it's 5 out of 5. Let's see, let me put back on your, oh, sorry, I got to look in between your toes. No breakdown in between the toes. Okay, so for my last thing I'm going to do, I need you to close your eyes and tell me when you feel me touch, okay?
There. Yes. 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 Yes.
Okay, sensitivity to light touch is intact to the lower extremities. And her skin color is appropriate for ethnicity. Like I said, no edema. Warm to cool from proximal to distal. And I am done.